Depression is a common mental disorder that negatively affects how you feel, think, or act. It is estimated that about 5% of adults suffer from depression. Although the rate of depression is higher among women, about 5% compared to men, about 3%. This trend may be due to men having a lower tendency to seek help for the disorder. It is important to address depression in men as symptoms tend to manifest more as restlessness and impulsiveness in men, which could potentially lead to greater dysfunction in daily life. A particular concerning consequence of depression in men is that of higher suicide rates compared to compared to women, a ratio of almost 5.1, as men tend to use more lethal methods. This there is no one specific cause for depression. The disorder usually results from the interaction of biological, psychological, and social factors. These same factors can also perpetuate and prolong a depressive episode. Some non-risk factors include genetic factor. For example, if a family member has depression or other mental illnesses, psychological stress, for example, unemployment, isolation, changes in life stages, stressful situations, and so on. Chronic medical issue or even low testosterone level, substance abuse, chronic alcohol use, or other illicit substances. During a depressive episode, a person may experience low mood and other symptoms that include loss of pleasure or interest in activity, restlessness, lethargy, loss of appetite, negative cognition such as feelings of hopelessness, guilt, or suicidal thoughts. These symptoms usually occur for nearly the entire day for at least 2 weeks. The symptoms are persistent and pervasive, leading to reduced ability or inability to carry out meaningful activity. In essence, depression affects one's thought, feelings, behavior, and ability to handle daily responsibility. Symptoms of depression in men differ from women in a number of ways. For instance, men who are depressed tend to show more aggressive behavior and irritability instead of sadness. Apart from that, physical issues may also arise, such as having a lower sex drive, chest tightness, or digestive problem. Some statistics also suggest that men struggling with depression may turn to drugs or alcohol to cope, with rates of substance use higher in depressed men than in depressed women. Depression is a medical condition and, like other conditions, require a consultation with a doctor or other healthcare professional. He or she will be able to evaluate your condition and arrive a diagnosis either through the conversation or in other cases through talking with a family members or friend. They may also decide if there is a need to involve another health professional in terms of further investigation, medications, or talking therapy. The key thing is to not let the diagnosis make you feel as if you are lesser than others. There are effective treatment options for depression, and recommendation will be given depending on the cause, severity, and pattern of depressive episodes. For example, if depression is caused by a medical condition such as thyroid condition, treatment would be to address the thyroid disorder. However, if it is a primary cause unrelated to other medical condition, your doctor may recommend talking therapy such as cognitive behavioral therapy or antidepressant medication. A significant thing to note is that a depressed person does not choose to stay depressed, and depression is not a result of poor choices. If you feel that you might be struggling with depression, seek a consultation with a professional as soon as possible. Try to put into place a stable routine that includes regular exercise, social time, and avoid trying to take on too many activities at one time. It is also helpful to consciously avoid negative coping habits such as resorting to comfort drinking, eating, or use of illicit substances. If you suspect somebody may have depression, you may direct him to mental health professional. It may be more difficult for men to be willing to seek help for depression due to perception of societal role, but constant support and encouragement is always helpful if that person is on journey to seek help. While men with depression are at a higher risk of suicide, there are always avenues to reach out for help. If there is any cause of concern for self-harm or suicide, please seek assistance early with the police or emergency services. Alright, I have finished reading.